Hi, my name is Niamh. I'm a women's health physiotherapist here at the Rotunda, and this is Sinead. Sinead's first baby, and she's 35 weeks pregnant, and she's very kindly agreed to come along and have a chat with me, very similar to a lot of chats I have every day with women here in the hospital. So Sinead, thanks for coming.
Thanks for seeing me. I've been referred from the midwives clinic there last week, and because I've been experiencing this awful embarrassing problem of wetting myself.
Right.
And it's been happening really throughout the whole pregnancy from the beginning, but because it wasn't happening that often, as the pregnancy is progressing it's happening more often, and
Right.
it did actually happen prior to the pregnancy as well.
Okay.
So it's quite an embarrassing problem, and it happens at certain times I'm not expecting it.
Mm-hmm.
So the girls in the clinic have told me that I have something called urinary incontinence.
Okay.
So I'd love to hear more about what it is.
Right. Okay, well, urinary incontinence is basically what you're describing, which is wetting yourself when you don't mean to.
Okay.
It can happen when you're laughing, or sneezing, or coughing. It can happen during sex. It can happen when you go to lift something up. That's stress incontinence, so it happens when your body is experiencing a stress.
Okay.
And then there's urge incontinence. You can wet yourself on the way to the toilet. It can be a small amount, it can be a large amount. And it might be something that you have experienced since childhood, like yourself, or it might happen when you're pregnant or after you have a baby, or it might happen with future pregnancies.
Right.
And a lot of women are told it's normal just to put up with it, and you might be advised just to get on with life.
Okay.
But it's not normal. It is very common. About 1 in 3 women will experience problems like this, but it's not normal because it can be helped. You can do something to change it.
Okay.
Other women don't talk to anybody about it. They just suffer in silence. They feel shame and embarrassment. They might even have bowel symptoms, not being able to control the bowel fully.
Okay.
And I would encourage anybody not to suffer with those kind of problems to come and talk to your GP or your midwife or your women's health physiotherapist, because you can be helped.
Okay. So Niamh, why is this problem getting worse as my pregnancy progresses?
Well, pregnancy causes an awful lot of changes in the body, as I'm sure you're aware. There's hormonal changes, which can affect the pelvic floor. And then there's the increasing weight of your baby on the pelvic floor, which acts like a hammock underneath to support. So both those things can be a big challenge when you're pregnant.
Okay. And is this problem going to go away after I have my baby?
Well, in some women it does go away once the baby is born. In other women it doesn't, it gets worse. And for some women it starts for the first time after they deliver their baby. And your symptoms can get worse as you get older, or with future pregnancies, or as you put on weight when you get older. And this can be very difficult because often women are told to lose weight to protect them against incontinence and other issues. But then when they go to exercise, like running or jogging, they leak and they feel embarrassed. They stop exercising, they increase weight, and it can be a bit of a vicious circle for them.
What is it that I can do in my pregnancy to try and help me address the problems?
Well, there's 4 main things that you can have a look at first, and it's never too late to address these problems. The first thing that you should look at is your fluid intake. Are you drinking enough fluids? You should be drinking about 1.5 litres to 2 litres of fluid a day, as much of that being water as possible, reducing down your tea, coffee and fizzy drinks because they can irritate the bladder.
Okay, and that's something I haven't been doing.
Right.
I've been putting off drinking fluids because I feel if I drink too much I'm going to have more episodes of wetting myself. So.
Yeah, a lot of women do that,
Yeah.
but it's a mistake. It can irritate the bladder,
Okay.
and it can make your symptoms worse, and it doesn't help.
Right.
So the next thing that you can look at then is the issue of constipation. Because when you're constipated, you strain on the toilet, and this weakens your pelvic floor muscles further. So it's important to have a look at the cause of the constipation. Do you need to change your diet? Do you need to drink more fluid? Do you need to talk to your GP about the medications that you're on? And do you need to look at your toileting posture? So in terms of your toileting posture, it's important to always sit on the toilet to empty your bladder, to never hover. Okay, even when you're just emptying your bladder, okay? Because when you hover, you don't relax your pelvic floor muscles properly, and you can retain some urine in your bladder. So if you're worried about the toilet seat, clean it off, but sit down on it, okay? And take your time, never push urine out, okay? Let it come out naturally. And then with the constipation, have a look at your toileting posture, okay? So a good thing to do can be to put a stool under your feet, so that you raise your knees higher than your hips, okay?
Yeah.
And then lean forward, but don't slump. Keep your back straight and lean forward. Relax your elbows onto your thighs, okay? And then breathe in, relax your tummy, and then push towards your back passage as you breathe out. but don't push hard. It shouldn't be a strain. You shouldn't be pushing very hard, okay? So you look at fluid intake, you look at toileting posture, you look at constipation. And the fourth thing that you can look at is your pelvic floor muscle exercises, and these are vitally important. If you learn to do these exercises correctly, they can make a huge difference to your symptoms and to your quality of life.
Right.
So thank you very much, Sinead, for coming along today. I really appreciated it. If you would like to learn more about pelvic floor muscle training, have a look at some of our other videos. I hope you found this video useful. It's definitely important to look at your fluid intake firstly, to look at your toileting posture, to address constipation, and to learn to do your pelvic floor muscle exercises correctly. So thank you very much for watching today.